This is called 0 to 3, it is incident, and when we talk about 4 to 7, it is called accident. As per the INS user manual, it has been published by IAA in 2008 edition. Now, why incident occurs that we should know. First and foremost thing, what happens and why this incident occurs. The important thing is inadequate communication, maybe training, inadequate awareness of the workers to radiation safety, or workers are not informed of the presence or location of the radiation source or radiation generating equipment, or they are unaware that a source will be maintained at that location. So, any one of these causes may lead to some kind of incident. Now, question arises that why incidents to be reported, even if the incident takes place, why we should report the incident? See, hazard, causes and contributing circumstances are lost if not reported. Incident has taken place, and if we don't report, the hazard of causes, why it has happened, is lost. It makes us very important to report this incident. The fact that many incidents come within inches of being disabling injury accident, making failing to report them all the more serious. If you don't report, then it may lead to some kind of fatality or may go to the accident mode when we define the event. When incidents are not reported, their causes usually go uncorrected. That means they may happen again, perhaps producing tomorrow's disabling injury or fatality. So it is must, we should report the incident. Why the incident is not reported, though it should be reported if the incident takes place. The most common failure is to understand the importance of reporting and the harm that could result by not doing so. If the incident has taken place in your department, then generally we don't understand that if we don't report, what will happen. So until and unless then we know the common failure, until and unless we don't know what is the understanding is proper, we will put the incident. And that is the main reason the incidents is not reported. It may happen that many employees do not want to report an incident because of the following reason. Either maybe fear of management disapproval or not wanting the incident on their work records, dislike for the red tape involved, not wanting to lose time from job assignments, reluctance to spoil the department's safety record, not wanting to be the subject of incident investigation. So definitely incidents are happening, but because one of the any causes which I just told, there is a failure or the incidents are not reported. What can be learned from an incident if the incident takes place? The whole purpose of reporting and investigating near miss incidents is to find ways of making sure the same elements that were present on that occasion do not result in an accident at some future time. The answer should suggest ways to prevent recurrence. Perhaps there is a need to develop new rules or procedures, or maybe more thorough training is required. In any case, the reporting of the incident is the first and foremost vital step that needs to be taken, and keeping in mind that it will lead to accidents in the future. So here are certain questions to which answer must be sought. What were the circumstances surrounding the near miss? Why this incident has taken place? Was there a hazard that employees should have been aware of? Is there a safety rule covering the situation? If so, did the almost victim know it? If there is not such a rule, should there be one? Were any safety devices, clothing or equipment used improperly or not used at all when they were called for? Have there been other near misses at the same time? The foremost and important thing, we should find out the root cause analysis of any incident which has taken place to prevent the recurrences in the future and not allowing to become an accident. Stop, think, and act. Is the workplace as safe as it could be? How well prepared is the organization to prevent and manage incidents? Such questions should always be fully in honesty answered by the radiation safety officer or radiation protection officer who takes care of radiation safety in your organization and should always be matter for critical examination, especially in facilities where the activity of radioactive source involved is high. An incident management reporting system helps you answer these questions and ensure that the organization is always prepared to prevent and manage near misses, incidents, and accidents. Incident reporting is the requirement of any occupational health and safety management system, and when this is not done efficiently, the flow-on effect may result in excessive cost to the business besides the human exposure. Importance of reporting. Why incidents reporting? I'm keep on insisting whatever mechanism is there in your country, in your organization, please do report the incident. Employees should be encouraged to complete incident reports if something happens, as the process and information can benefit everyone. There are few reasons which tells that reporting incident is important. Reporting enables the correction of the situations and helps to prevent similar future occurrences. Reporting allows employers to trend incidents and proactively identify potentially hazard conditions, keeping the workers safe. Incident reporting can act as a heads up to management that helps identify potential problem areas that needs to be fixed. Prompt reporting provides management with a historic record of the facts when the incident occurs. As time passes, facts become clouded and recollection of details fades. Key evidence during the time of incident needs to be documented right away, allowing for a plan of actions to be enacted immediately that will help all parties to manage the situation. By quickly reporting incidents, time loss can be avoided, light duty can be provided right away, allowing the exposed employer return to work in a capacity that meets the restriction. And I understand that after seeing this slide, have the habit of importance of reporting the incident. Now question arises, when should I report an incident? It is extremely important to report incident right away, no matter how minor it may be. Even if the exposure is minor or if there is no exposure and you feel it is not worth reporting, incident must be documented. Who should I report? When the incident occurs, you should report immediately to your supervisor. Do not fear reporting. It is a necessary aspect of creating a safer work practice, play for safe workplace, and you are protected by the law. Lack of commitment to holistic safety. Many incidents resulted from organizational business not adopting a holistic or systemic view of safety. For example, incidents have occurred even when organizations focus on procedures, interlocks, and barriers. While these are important areas to consider in the management of safety, it is equally important to consider human and organization factor. For example, many of the incidents may not have occurred had the organization provided trainings to staff on how the interlock works and provided safer system of work. Example, using a checkbox, easier system protocols that handwritten notes should be provided that how to see to it, how this interlock works, because interlocks and other administrative mechanisms are there, but the no training is provided how to act on if certain incident has taken place. The lesson to be learned from the incident is that in addition to addressing technical issues, safety management needs to consider human and organizational factor and develop a safety culture in the organization, learn more about the holistic safety. There are incident reporting agencies that are there. We talk about Australia or UK or USA, France, Russia. Every country's regulatory authority is having an incident reporting agency, and the same we have in our country that is called Atomic Energy Regulatory Board. What are the unusual incidents happen in nuclear medicine? As we all know, misadministration, wrong radiopharmaceutical, wrong patient, lactating patient, pregnant patient, wrong route, wrong acting, spillage of radiation, personal contamination, death of patient with high activity. These are all termed as unusual incidents in nuclear medicine. Misadministration countermeasures immediately use all available means to minimize any adverse effects such as expeditious removal of orally administered radiopharmaceutical by MSs, gastric lavage, laxatives, or enemas. Accelerated excretion of intravenously administered radiopharmaceutical by hydration, diuresis, etc. Removal of urine by catheterization from patients who cannot void spontaneously, and when appropriate, use of blocking agents to diminish the absorbed dose to the thyroid gland, salivary gland, and stomach. Misadministration consequences, not justified exposure, it increased the radiation risk, it delayed the diagnosis, it increased the cost, increased the workload, reduced confidence. Radiation safety implication in handling incidents in nuclear medicine. Patient safety is one of the most important things. Then personal safety, then worker safety, then environment safety. All safety has to be taken into account, and this method has to be followed. Estimation is generally done by radiation safety officer, radiation protection, or whatever name you have, or a radiation safety officer, or a person who is taking care of radiation safety in your organization. Management of radioactive contamination when we talk, suppose contamination has taken place. Persons suspected of being significantly contaminated should be removed from the area of contamination. In the event of major spill involving adding radioisotope, the use of thyroid blocking agent, for example, potassium iodide should be considered. Take particular care in case of yttrium-90 chloride or particular steroid spread to wounds, eyes, nostrils, or mouth. Personal decontamination should be undertaken according to the areas of body and as follows. Eyes should be irrigated with saline solution, 0.9% sodium chloride solution, or be distilled or made water. Hands should be washed with tepid water, mild soap or hand soap solution. And during the period of COVID in the last 2 years, we have learned how to wash hands frequently with 20 seconds protocol. Now, if we continue it, contaminated fingernails may be scrubbed lightly with a soft nail brush. For contamination that is difficult to remove, disposable rubber gloves may be worn for several hours to promote perspiration of the hands. It may assist in removal of contamination while preventing its spread to other surfaces. Pistons other than that of hands should be swept gently with a cotton wool pad soaked in a mild soap and hand wash solution. Preferably neutral pH the solution should have, and rinse well. Do not vigorously scrub the skin using detergent, as this may affect the natural skin barrier and increase the risk of internal contamination. Contamination wounds should be washed under fast running tap. If the wound or the face, care should be taken not to contaminate the eyes, mouth, or nostrils. Finally, the wound should be washed with water and gentle antiseptic and waterproof dressing applied, and attempts to remove all contamination from the skin may not be feasible or desirable. Some radioactivity may be trapped in the outermost layer and will remain until normal thawing hours 12 to 15 days. Personal decontamination should be continued until monitoring shows that less than 10% residual contamination removed at each cycle, unless there is a risk of contamination entering the bloodstream through the roughing or breaking of the skin. If the contamination is due to added radioisotope, the affected area should not be treated with any material that contains oxidizing agent or acids, as this can result in the production of volatile molecule of radioiodine and risk of inhalation. The use of acid or metal surface may also cause unnecessary corrosion and result in a greater difficulty in future decontamination procedures. If the measurement of residual contamination indicates that the level of radioactive contamination remains greater than the permissible limit, the item should be stored to allow the radioactivity to decay, and also action should be taken to prevent the accidental return of the item into stock or other use. Now, death of the patient is one of the incidents which you cannot avoid, because it can take place in a high dose therapy ward where high dose iodine is already being administered, and after the same, the patient died, collapsed because of the reasons unknown during that time. A nuclear medicine physician concerned should ensure after consultation with the nuclear medicine physicists, the technologists, that the exposure to radiation of any person handling the body is minimized at the time of death. The body should be clearly labeled with the radionuclide form and what is the estimated residue activity. The body should be handled as little as possible using strict procedures for prevention of contamination with body fluid. If the patient dies shortly after undergoing a diagnostic nuclear medicine procedure, no special precautions are required because we all know in case of diagnostic nuclear medicine, the activity administered is very minimal in the range of 3 to 5 millicurie. If an autopsy is required in such cases, consideration should be given as to whether a CT examination will be sufficient or not. The COPS contain activity in excess of the limit prescribed by the regulatory authority of your country or in our country. Autopsy cannot be postponed for a suitable period of for radioactive decay. The doctor performing the autopsy should be informed of the radiation levels likely to be encountered. Autopsies is always discouraged. If it is known that radioactive material used for treatment will have been selectively absorbed in a particular where I was a part of the committee preparing this document for medical events. But this document is many countries have not started using it or not. That is use of inner scale for unplanned events affecting patients undergoing medical procedures and additional rating guidance how to rate the event which has taken place in the medical practice. I'm not talking about Atomic Energy Regulatory Board, our regulatory authority in the country. We have a system how to report through our e-licensing because this is the country where license all consents are being issued online. Online system is there. So this is the portal which is called e-LORA, e-licensing of radiation, where if you go to that particular website, we have a regulatory form talking incident report mechanism is there. How to report it already helped me know it brought about. If incident has taken place, incident report you have to submit over there. Once you have to fill what's the date of incident, what type of incident, what type of incident, where the source loss has taken place, person in charge of incident, contact number, all this then you can fill it up and next time you have to update the incident as in when the progress takes place and what is the update because it may not be happen once the incident takes place you have to directly report it then you can update the report consequently then we can invest incident investigation report that comes after the incident investigation taken place by the organization. So what I want to say that we have a mechanism well established for reporting in our online and that not only takes helps the regulatory authority, but that will also help the others in the country that how to avoid such incidents. With this, I am really again thankful for a patient hearing. Thanks to AFOM, thanks to Dr. Chogle and Dr. Rajni for introduction and giving me an opportunity to talk on this subject. Thank you very much. Over to Dr. Rajni. If any questions are in chat box, I would be happy to answer. Thank you very much.
Thank you so much, sir, for such an elaborate